back to Good Morning Pathophysiology with your hosts, Ghana Raya and Claire Nydia.
Now we have a man whose girlfriend has HPV, but she didn't get it from him. Let's take a look.
She's got HPV, she's dying now. HPV, and I'm crying now. And I don't even know what it means. She's got HPV, who's she cheating on me? HPV, did she eat something? Won't you please tell me?
Well, we did some of our own research on HPV. Let's take a look at the history of HPV. So in 1949, that's when HPV was first described. It was examined in the aqueous extract of the wart tissue.
And in 1963, physical properties of HPV DNA were described.
And then in the 1970s, HPV was discovered to play a role in cervical cancer.
And then in 2006, the first approved HPV vaccination was made. For an expert opinion on HPV, we invited a CDC doctor and nurse to the studio.
Yeah! Woo!
Welcome.
Do you guys want to introduce yourselves real quick?
Yeah, hi, I am Dr. Herps.
And I'm Nurse Sif.
Awesome. So we just have a couple questions for you guys about HPV. So what are the pathologic characteristics of HPV?
Yeah, I can answer that one. So HPV is one of the most common STIs or sexually transmitted infections. HPV is a small, non-enveloped DNA virus that infects the skin or the mucosal cells. The virus enters the epithelium through the disruption of the skin or mucosa and infects the basal stem cells. HPV prefers to integrate at fragile sites in the human DNA where the strand is prone to breakages.
Oh, that's interesting. So what are some possible changes in the body that can occur from HPV?
Yeah, so unfortunately most people who have a high-risk type of HPV will never show any signs or symptoms of the infection until it's already caused serious health problems.
But depending on the strain, HPV can lead to the development of different warts such as flat, common, and plantar that can occur on the hands, feet, and face, as well as genital warts. And those genital warts are rough, cauliflower-like lumps that grow on your genital area.
Yeah, and some of the high-risk strains of HPV can lead to cancers. So some of them will affect the cells of your cervix, known as cervical dysplasia, which then can grow into cervical cancer. There are also other type of cancers that HPV may cause, such as anal, penile, throat, vaginal, and vulvar as well.
And if HPV has led to cancer, changes such as color or thickness changes of the vulva or penis may occur. Anal bleeding, problems breathing or swallowing, or pain in the vulva, penis, anus, or throat may also be signs.
Very interesting. So after knowing all of that, how is HPV monitored and treated?
So there is no treatment for the virus itself. However, there are treatments for the health problems that HPV can cause. So in most cases, HPV does not need to be treated and will go away on its own, normally within 2 years. And if it does not go away, it often results in genital warts or cancer.
Yeah, and if genital warts do appear, they can go away with treatment from your healthcare provider. And if they are left untreated, they may go away, they may stay the same, or they can grow in size.
And so cervical precancer treatments are also available. Women who get routine pap tests and follow up as needed can find problems before the cancer develops. And this prevention is always better than the actual treatment of cancer. Cancer caused by HPV can take years to develop, and it is uncertain if you will have cancer. So it is important for those that test positive for HPV to get routine testing.
And if you are diagnosed with any type of the cancers mentioned before, it is very important to go see your doctor regularly and get the adequate treatment such as chemotherapy or radiation for those cancers.
Okay, we have one last question since we are honored with a nurse at the studio. We were wondering if there's any nursing diagnoses that are associated with HPV.
One of the nursing diagnoses that I see the most is the risk for loss of self-esteem related to the HPV diagnosis, the genital warts, and the other growths. Because having HPV can be embarrassing, stressful, hard on an individual's self-esteem. So this is why patients are at a risk for the loss of their self-esteem after being diagnosed. However, after the treatment of symptoms such as warts, as well as helping the patient understand that there is no shame in their diagnosis, this can help decrease their risk.
Okay, well, thank you. Thank you for being here.
Thank you guys for coming.
Thank you for having
Have a
us.
safe trip back to the CDC.
Thank you.
And we will be back after this break.
Are you feeling sad, lonely, or depressed because you can't get an erection? Not to worry, Viagra is an FDA-approved medication to treat erectile dysfunction, so you and your little buddy can get the job done. Common side effects are headache, flushing, dizziness, abnormal vision, diarrhea, and rash. Do not take if allergic to nitrates. Call doctor if erection lasts over 4 hours. This med does not prevent STI or STD.
Now we're taking our HPV interviews to the streets. Here's somebody right here. Can we interview you?
Hi.
Can we interview you for our show?
Oh, yeah. Oh, Tiny.
Okay. What do you know about HPV?
You know what? I'm the perfect person because I have it.
Oh.
See, one day I was waking up in my nursing home and I was feeling fine because I didn't have any symptoms. And then my hoo-ha was getting all red and itchy. And I got these warts that look kind of like cauliflower, but not the good kind that you can eat. And so I was like, oh my goodness. So I'm going to be having my grandson, he going to be looking up for me because I don't got no access to the interweb. So he looking up and the typical presentation that I think he said was your hoo-ha, right down there. It's going to be all red and itchy, swollen. And so I was like, that's what I got. I got them warts on there. So yeah, so that's all. That's all I got.
Do you have anything else to add? Welcome back to the studio. We hope you enjoyed that interview. Next, we have a special gift for you guys. We managed to find the creator of the original TikTok and invited him here today.
Hey, what's up, guys?
Hello, thank you for coming.
Oh, I'm here.
Do you want to introduce yourself really quick?
Yeah, my name is Grant G Money on TikTok. Be sure to check it out. But yeah, I wrote that song when I was feeling down, and it just turned my life around.
Hey,
Yeah.
we're glad to hear that. We have a couple of questions for you. So first off, what do you already know about HPV?
Well, when I was writing that song, I didn't really know anything about it, but I did some research, talked to my friend who's a doctor, and he kind of explained a lot of it. And I found out there's actually a bunch of different types. There's actually over 100 different types of HPV.
Wow.
And on the down low, I kind of hope she gets all of them,
Oh,
But you didn't hear that from me, but I'm just saying.
Okay.
And then I also know that it actually clears up on its own for 9 out of 10 cases in less than 2 years. So
Wow.
yeah, that's kind of
Those are
some interesting facts that my doctor friend told me. Yeah.
Well, we actually have a special surprise for you.
Oh boy.
We also invited your girlfriend on the set.
You missed me?
What are you? What the?
We also have some questions for you as
course.
Do you want
well.
to introduce yourself first?
Okay, so I'm Sapphire.
Ooh.
I don't know. I guess.
Yeah, you don't know, do you? You never know. You never know.
Okay.
So yeah,
anyway,
So our
I'm,
first question, how was your HPV diagnosed?
Well, I was getting the yearly, checkup and stuff, and I got a pap smear test, but then it came back abnormal. But I don't know. I had a Dr. Fred McDreamy, and he just said
my doctor friend.
Okay, moving
What?
on. So,
He said it'll be fine.
what exactly is the prognosis of this disease? So what exactly is going to happen now for your future?
Okay, so I got a colposcopy that just kind of looks at the cervix. Is he okay?
It'll be fine.
Okay.
It'll be
I looked
I'm
closely at
not
my
fine.
cervix to see
I'm
if
not.
I have any precancerous cells, the huge. And then I got a cryotherapy, so it's just like a treatment that kind of just frees some cells on the cervix, and then if that doesn't work, they're gonna just take a little laser and try and get it off,
Sounds good. And then what happens if it comes back?
You cry.
Okay.
Oh.
Fair enough.
Oh.
Okay.
Okay.
Yeah. So Grant, do you have any?
I don't know. I'm honestly, guys, I'm done here. This is.
Okay, that's fair. I guess we can end the show then. So
This
You
is.
can have your ring back.
Oh.
Yeah.
You were
Yeah. Can I have it
engaged?
back?
Okay, so thank you so much for joining us.
on this special episode of Good Morning Pathophysiology.
Thank
You
you.
have a great rest of your day and join us tomorrow morning when we talk about COVID-19. Thank you.